So today I want to talk about toilet infection, wrongly so called. In my earlier videos I mentioned that there are some people that believe that they acquire infection because they use a particular toilet, and in that video I tried to educate us to understand that what is wrongly referred to as toilet infection is either urinary tract infection or sexually transmitted diseases. The female urogenital system is very different from the male urogenital system, and because of these anatomic differences, many women than men have urogenital system infection. In the video, one of the videos I also mentioned that it is not every time that the woman has vaginal discharge that it is infectious, that some of these discharges are normal changes in physiology, normal response of the body to hormonal changes, especially during the time of ovulation. Women may have some discharge, white discharge or even yellow discharge when this discharge is exposed to oxygen, and because it doesn't cause any problem, it is not itchy, it is not foul smelling, it may be normal physiologic changes that every woman can undergo during their menstrual cycle. However, there are some discharges that may be infective in nature. Example, the vulvovaginal candidiasis. So today I want to talk briefly on what the presenting symptoms of vulvovaginal candidiasis are. Vulvovaginal candidiasis is caused by predominantly Candida albicans. Others like Candida tropicalis, Candida crusei may also cause vulvovaginal candidiasis. But these other ones mentioned, apart from Candida albicans, may cause severe symptoms when a woman has vulvovaginal candidiasis. Now, what are the symptoms? What are the symptoms that the woman will notice in her body to make her suspect that she's having vulvovaginal candidiasis? One of the symptoms that a woman may notice in the body is having a thick, cordy, white V discharge. Thick, cordy, white V discharge. Now, something that is cordy is like if you know the texture of milk, the normal milk that we drink. If that discharge is like that, it could be yellow, it could be white, but it is thick, cordy. That may be signs that you're having vulvovaginal candidiasis. Another thing that may be seen in such a patient is there will be itching of the vulval area. There may also be vulvovaginal edema. Edema is like fluid or water. The area would be swelling. Okay. There may also be redness of the area, and sometimes some rashes that go around in circle. We usually call satellite rashes. Maybe in the vulval area. Okay. There may also be excoriation. Excoriation is inflammation, kind of wounds that somebody has around the genital areas. These are some of the symptoms. Itching is one of the symptoms also. The vulvovaginal area would be itchy, and of course the thick, gaudy vaginal discharge. So what are the risk factors that may make people have this vulvovaginal candidiasis? Vulvovaginal candidiasis is not always sexually transmitted. It is not always sexually transmitted. Sometimes it may be as a result of immune suppression. If the immune system is suppressed, somebody may have vulvovaginal candidiasis. People who are pregnant, because of the circulatory hormones in the system, they may have. And of course, people that have diabetic patient may have this condition. And also, people that are using high level of combined oral contraceptive pills may also have this condition. And people that are using immunosuppressive drugs, people that are on chemotherapy, may also have this condition. And of course, people who have HIV disease may have this condition. And most importantly, a woman who cleanses herself seriously, cleanses inside with soap, with any other substance, scented liquids, may destroy the normal residence of the V environment. That is, the lactobacilli can be destroyed, thereby allowing other harmful microorganisms to occupy the area, changing the pH of the V area, which is normally 3.5 to 4.5. Once scented liquids, scented creams, scented soap, any other thing apart from clean water is used in that area, the environment can be altered. The normal microbiota of that environment can be altered. The lactobacilli that are in that environment are capable of producing acid. That acid is to help the area to be free from harmful microorganisms. But when the environment is disturbed by the use of all these elements, by use of soap, scented liquid, creams, and any other thing that's supposed not to be used, the normal residence can be destroyed. And once that happens, harmful microorganisms can begin to occupy the environment. And of course, like I have said, vulvovaginal candidiasis is not only sexually transmitted, but it can be sexually transmitted. That means if a woman is having a partner that has this condition, that there could be transmission. Okay? So it is not only sexually transmitted, but it can be sexually transmitted. And of course, we have listed some of the predisposing factors to having this condition. And one of the ways that somebody may know that they have this condition is if they have thick, gaudy, whitish or yellowish discharge, or if they have itching of the vulva, or if they have excoriation, if they have redness, if they have erythema, okay, this may be an indication. Or they have some small rashes around the area, it may be that they have vulvovaginal candidiasis. So if somebody has this, what should they do? If somebody has these symptoms, they should not hesitate to go to the hospital and see the doctor, who will take history from them, perform examination, and then carry out investigation, and then treat them. The specimen, the sample could be collected. Okay, the doctor would ask that the specimen should be collected for investigation, laboratory investigation, and then the doctor would also prescribe something that the patient would use to handle the infection. And of course, if the problem is a result of maybe diabetes, the sugar level should be properly controlled. Or if the person is taking combined oral contraceptive that has very high level of the hormones, estrogen, progesterone, it should be changed to low level combined oral contraceptive. And of course, if the person was doing excessive douching, that is cleaning of the area with soap, scented liquid, or any other substance that's supposed not to be used in the area, if the patient was using that, they should stop using it and use only clean water when they are taking their bath. Okay, and moreover, if the patient is HIV positive, they should also take their medications so that the viral load can be controlled to low level. And of course, good nutrition is also very important. If somebody is having this condition and is diabetic, for example, they should watch out for what they eat. People who are diabetic are encouraged to do exercise, okay, because when they do exercise, it makes the body to become sensitive to insulin, thereby the blood sugar level will be controlled. So if somebody is diabetic and they are taking their prescribed medication, they should also do exercise. It is not only medication that they should take, they should do exercise and stick to their diet plan. Whatever plan that their dietitians have given them, they should stick to it. So I hope with this information you'll be abreast with what vulvovaginal candidiasis is, the symptoms that one may see, and what they need to do in order not to have this medical condition that is wrongly called toilet infection. Share, like this video, put your comments in the comments box. Please follow my page, and if there is any more thing that you want to know on this topic or in any of the topics that I've posted, please do not hesitate to drop that information in the comments box, and I will try my best to make sure I respond as soon as I can to any query that you may have. If you need any form of help within my abilities, that is medical advice, do not waste time dropping your comment there. Then I will do my best to respond to you. Thank you. Share, like, comment.